Hello, everybody. My name is Steven, and this is my podcast on major depressive disorder. Because I was kicked out of the library, I'm going to have to do the presentation like this, but I am starting in the top left corner and moving down. So, to get started, for a definition of major depressive disorder, I have a brain disorder characterized by persistent depressed mood or a loss of interest in activities causing significant impairment in daily life. It's absolutely natural to have a bad day, to feel sadness, maybe a loved one passed away, or maybe you're going through an illness. But these symptoms or these feelings of sadness are usually short-lived. That's the difference between normal sadness and major depressive or disorder, because major depressive disorder lasts for long periods of time and is very intense. Major depressive disorder, or clinical depression as they also call it, is common but is very serious and it can cause severe symptoms that affect how you feel, think, and handle daily activities such as sleeping, eating, or working. And in order to be diagnosed with depression, the symptoms must be present for at least 2 weeks. So now that I've kind of explained this to you, if you don't quite have major depressive disorder, you may have I'm going to try to pronounce this subsyndromal symptomatic depression, or SSD, which is a term that indicates a person's depression symptoms don't quite meet the criteria for a diagnosis of of a major depressive episode, but it's actually quite common. Now, I tried to box these words, several persistent symptoms, right there in the corner, to really just point out that these symptoms have to be there for a while and they have to be intense. But to keep from getting ahead of myself, I have some common facts right there in the bottom left corner. There are about 3 million cases each year, and ages affected are kind of in all ranges, but it tends to get very serious in your teenage years through your 20s and 30s. That is where it's most commonly occurring. It's midterm, so it can resolve within a couple months, but to get into some risk, depression, especially in midlife or older adults, can co-occur with other serious medical illnesses such as diabetes, cancer, heart disease, or Parkinson's disease. These conditions are often worse when depression is present. Sometimes medications taken for these physical illnesses can cause side effects, which contribute to depression. It's also a fact that more women are likely to be diagnosed with depression. But some certain factors that seem to increase the risk of developing or triggering depression include certain personality traits such as low self esteem, traumatic or stressful events such as physical or sexual abuse, a childhood trauma or depression that started when you were a teen, a history of other mental disorders such as anxiety disorder, or blood relatives with a history of depression. This leads me into how it developed. Some possible causes of MNDD, include a combination of biological, psychological, and social sources of distress. Increasingly, research suggests that these factors may cause problems in the brain function, including abnormal activity of certain neural circuits in the brain. It could be biological differences, it could be a discrepancy in your brain chemistry, hormones, or it can be inherited. There are several factors that can increase the risk of developing a condition of MDD. A combination of genes and stress can affect the brain chemistry and reduce the ability to maintain mood stability. Changes in the balance of hormones might also contribute to the development of MDD. So, what are some symptoms exactly? The persistent feeling of sadness or loss of interest that characterizes major depression can lead to a range of behavioral and physical symptoms. These may include sleep, appetite, energy level, concentration, daily behavior, or self esteem. Depression can also be associated with thoughts of suicide. But this leads me into the symptoms. The persistent feeling of sadness or loss of interest that characterizes major depression can lead to a range of behavioral and physical symptoms. These may include changes in sleep, appetite, energy level, concentration, daily behavior, or self esteem. Depression can also be associated with thoughts of suicide, like I said before. Mood, for example, your anxiety, sleep, waking up early, or excessive sleepiness. Whole body, excessive hunger, fatigue. Behavioral, agitation, excessive crying, cognitive, lack of concentration. Weight gain or weight loss. Also common, which is poor appetite or repeatedly going over thoughts. So, not everyone who is depressed experiences every symptom. Some people experience only a few symptoms, while others may experience many. But several persistent symptoms, in addition to low mood, are required for diagnosis of major depression. Now, how long these symptoms last will vary depending on the individual or his or her particular illness. Symptoms may also vary depending on the stage of the illness. Now, I said before, several persistent symptoms, in addition to low mood, are required for a diagnosis of major depression. So, there's a process in order to be diagnosed with major depression. For one, you have to have five or more of the following symptoms, and they have been present for the same 2 week period and represent a change from previous functioning. And at least one of the symptoms has to either be one, depressed mood, or two, loss of interest or pleasure. And this is coming straight out of the DSM 5, the handy dandy notebook of all disorders. Now, some of the symptoms they have listed straight from the DSM 5 are insomnia or hypersomnia nearly every day, fatigue or loss of energy nearly every day, diminished ability to think or concentrate, or indecisiveness nearly every day, either by subjective account or as observed by others. So now that I've laid out a lot of these symptoms, can this disorder be treated? And yes, it can. Even the most severe cases can be treated. The earlier the treatment can begin, of course, the more effective it is. Depression is usually treated with medications or psychotherapy or a combination of the two. If these treatments do not reduce the symptoms, you can resort to electrocompulsive therapy and other brain stimulation therapies may be options to explore. But no two people are affected the same way by depression, and there is a no one size fit all treatment. It may take some trial and error with your doctor to find a treatment that works best for you. The mainstay of treatments is usually medication, talk therapy, or a combination of the two, like I said before. But increasingly, research suggests that these treatments may normalize brain function and is associated with depression. So, if you decided to get therapy to treat this disorder, you could get cognitive behavioral therapy, behavior therapy, or psychotherapy. And just to give you an explanation of one, psychotherapy is a treatment of mental or behavioral disorders through talk therapy. Now, let's say your case is more severe and you have to go towards medication, and regular therapy isn't enough. You may take a selective serotonin reuptake inhibitor. You guys are going to have to pray for my pronunciation for the next couple minutes. An SSRI eases symptoms of depressed mood and anxiety, and an example of this medication would be Zoloft. You could also take an antidepressant, which prevents or relieves depression and elevates mood. An example of this would be Wellbutrin. You could also possibly take an anxiolytic, which relieves anxiety and tension and may promote sleep. You could also take an antipsychotic, which reduces or improves the symptoms of certain psychiatric condition. But let's say your specific case is very severe. You may want to undergo a medical procedure, which would be electroconvulsive therapy, which is treating mental illness by sending electronic currents through the brain to trigger a seizure, also known as shock treatment. So, if medications do not reduce the symptoms of depression, electroconvulsive therapy may be an option to explore. And based on the latest research, ECT can provide relief for people with severe depression who have not been able to feel better with other treatments. ECT can be an effective treatment for depression in some severe cases where rapid response isn't necessary or medications cannot be used safely. ECT can often be a first-line intervention. So, to my surprise, ECT isn't painful, and you cannot feel the electrical impulses. Before ECT begins, a patient is put under brief anesthesia and given a muscle relaxant. Within 1 hour after the treatment session, which only takes a few minutes, the patient is awake and alert. So, treatment is short, but it consists over a series of sessions, typically 3 times a week for 2 or 4 weeks. So now that I've explained a little bit about ECT because I felt it was interesting, there's also some specialists in this field that can help you. like a clinical psychologist, which treats mental disorders primarily with talk therapy, a psychiatrist, which treats mental disorders with medications, a primary care provider, which prevents, diagnoses, and treats diseases, or emergency medicine doctor, which treats patients in the emergency department. So to wrap it all up, I'm going to give you a brief history. Depression was initially called melancholia. The earliest accounts of melancholia appeared in ancient Mesopotamian texts in the second millennium BC. At the time, all mental illnesses were thought to be caused when someone was taken over by demons or possessed. They were then treated by priests. A separate class of physicians treated physical injuries, but not conditions like depression. The first historical understanding of depression was that depression was a spiritual or mental illness rather than a physical one. And this was a belief all the way up until the mid 1800s, because a lot of people felt like if you were acting this way, or if you had major depressive disorder, you were possessed by a demon or the devil. But now, thanks to technology, we are no longer throwing holy water on people having a bad day. Ha, there's a joke for you. But anyway, thank you very much for listening to my podcast. Again, this is Stephen McClary with Major Depressive Disorder. I believe I went over everything, so I should get an A. If I don't, that's fine. It's fine, you know. I worked pretty hard on this, though. You saw that's a lot of writing. My hand is still cramping. Um, but yeah, I think I'm done. I'm just kind of procrastinating now because I have to use a certain amount of video length in order to combine all the videos. So I'm going to sing you a song in the meantime. Somewhere